Galactose is exclusively metabolized in liver. Exclusively metabolized in liver. Yes. So means galactose metabolism can be used to assess liver function. So galactose metabolism can be used to assess liver function. What is galactose? Is epimer of glucose at carbon number 4. So we found that first of all we will take a galactose molecule, we will attach energy. Yes, energy galactose 1-phosphate, galactokinase, galactose 1-phosphate. Before moving further, I will draw a diagram here. We found that this is renal tubule, glomerulus. This is renal tube. These are renal tubule. You all know, descending loop of Henle, ascending loop of Henle, whatever it may be. Yes, we know that glucose, galactose, galactose, fructose are filtered via glomerulus, but you know that glucose is reabsorbed. I take green color. Reabsorbed. All these three are reabsorbed, but glucose and galactose are having high renal threshold, but fructose is low renal threshold. Why? Because if a child is born, the main diet is lactose. Lactose is made up of glucose and galactose. That's why nature said when child is born, most of the glucose and galactose which is filtered via glomerulus should be reabsorbed. So nature gave our kidney, renal tubule so much of power to reabsorb glucose and galactose. But you know, fructose comes late in our life. When we start taking fruit juice, then fructose comes in our life. But a child, when it is born, then child utilize only and only lactose, and that's why nature kept in mind to reabsorb glucose and galactose completely. Maximum threshold. Got the point? Leave it. Now, this galactose increases. Yes, if this galactokinase is deficient, then we say it is minor type of galactosemia. This galactose increases in blood. This galactose is converted to galactitol by aldose reductase. This galactitol, yes, accumulate in lens to produce oil drop cataract. Other name of galactitol is dulcitol. So this is oil drop cataract due to accumulation of galactitol or dulcitol. Only symptom of minor type of galactosemia is galactitol or dulcitol. We found that galactose 1-phosphate react with UDP glucose. Even if you don't remember much, I told you, yes, we will take galactose 1-phosphate will attach to UDP, will hold the OH, will rotate to right. UDP galactose will be converted to UDP glucose. So galactose 1-phosphate react with UDP glucose to form UDP galactose, and the name of enzyme is galactose 1-phosphate uridyl transferase. Means galactose 1-phosphate, yes, uridyl transferase. So please, galactose 1-phosphate, galactose is transferred to UDP, yes, and this UDP galactose is converted to UDP glucose by UDP galactose 4 epimerase. C4 epimerase, and UDP glucose is converted to glucose. Clear? And in this way, galactose metabolism is nothing but conversion of galactose to glucose, and we found that if galactose 1 phosphate uridyl transferase is deficient, then it is called classical type of galactosemia. If this enzyme is deficient, then galactose 1 phosphate will accumulate. This galactose 1 phosphate will accumulate, galactose will also accumulate. Galactose will be converted to galactose. So okay, leave it. Suppose this is galactose, this is UDP, this is galactose, UDP galactose. Now yes, I want to attach galactose to UDP, so I will transfer galactose to UDP. That's why you can say UDP uridyl transferase galactose. So if I don't remember exact name of the enzyme, I can say galactose 1 phosphate. We will attach galactose of galactose 1 phosphate to UDP to form UDP galactose. Means we transfer galactose of galactose 1 phosphate to UDP. So that's why we can say galactose 1 phosphate uridyl transferase. So this is UDP, my hand is UDP. I told you whenever glucose carbohydrate want to do new work, it attaches itself to UDP. Now this galactose will attach to UDP. Now we will hold OH from left and will convert to rotate to right. UDP galactose will be converted to UDP glucose. I told you the only difference between galactose and glucose is OH orientation at C4. If OH at C4 left side, it is galactose. If right side, it is glucose. Okay. So yes, so galactose metabolism is nothing but conversion of galactose to glucose. So UDP galactose is converted to UDP glucose by UDP galactose 4 epimerase. Why 4 epimerase? Because galactose is epimer of glucose at C4. Understood, Divya? So this is galactose. OH at C4 is on left side. I want to make it glucose. I will hold this OH and rotate this to right side. But we know that if you will rotate, the complete molecule will rotate. That's why what we did, we took yes, is it clear now? So again I repeat, this is important. I say galactose is metabolized by galactokinase, galactose 1 phosphate uridyl transferase, UDP galactose 4 epimerase. If this galactokinase is deficient, then galactose will accumulate. Galactose will be converted to galactitol. It will accumulate in lens to produce oil drop cataract. Yes. Yes, let me show you. Suppose this is galactose. And if you want to convert into glucose, if you try to rotate, the complete molecule will rotate. What I did, I fixed this galactose in UDP. Now I rotate this OH. This UDP galactose is converted to UDP glucose. Clear? Suppose this galactose 1 phosphate uridyl transferase is deficient. This galactose 1 phosphate will accumulate. Yes, this is very, very important. This galactose 1 phosphate will accumulate in brain, will cause mental retardation. Yes, galactose 1 phosphate will accumulate, means suppose this galactose 1 phosphate will accumulate inside the cell, and all galactose and all phosphate are joined. Now this child is having this enzyme deficiency. Now what happened? Listen carefully. In cytosol, liver cell, glycogen was there. This glycogen want to contribute blood glucose in between meal. You know that in between meal, blood glucose is maintained by liver glycogen by enzyme glycogen phosphorylase. But I told you glycogen metabolism. Whenever glycogen phosphorylase want to act, glycogen phosphorylase require phosphate. So yes, glycogen phosphorylase every time cut glucose with the help of phosphate, but in galactosemia, classical type of galactosemia, all the phosphate is in the form of galactose 1 phosphate. There is no free phosphate. When there is no free phosphate, glycogen phosphorylase will not be able to cut this. Do you understand this? Glycogen phosphorylase require phosphate to cut glucose from glycogen. So in classical type of galactosemia, there is no phosphate, so liver glycogen will not be broken down. This liver glycogen will accumulate hepatomegaly. When this glycogen will not be broken down, in between meal there would be hypoglycemia. Understood? So I have already told you galactose metabolism is nothing but conversion of galactose to glucose. In this multiple steps are required. If first enzyme is deficient, galactokinase is deficient, then galactose will not be converted to galactose 1 phosphate. Galactose will be converted to galactitol, oil drop cataract. In this, yes, if galactose 1 phosphate yielded transferase is deficient, galactose 1 phosphate will not be metabolized. This galactose 1 phosphate will accumulate in brain, mental retardation. When galactose 1 phosphate will accumulate, all phosphate are sequestered in galactose 1 phosphate. No phosphate, so glycogen phosphorylase will not work. That glycogen would not be broken down. Hypoglycemia, hepatomegaly. Clear? Yes, no free phosphate means, suppose, so I understand you. This is a liver cell. I make this. This is liver cell. This is liver cell. I remove everything for the time being to make you understand. This is liver cell. In this liver cell, suppose this is one cell of liver. In this liver cell, 100 molecule of phosphate are there. You took galactose, you ate, your child take milk. Milk is having lactose, glucose and galactose enter the liver cell. This galactose is converted to galactose 1 phosphate because galactokinase is there. So 100 molecules of galactose converted to 100 molecules of galactose 1 phosphate. Clear? 100 molecules of galactose 1 phosphate. Now in this liver cell, yes, glycogen is already present. Yes, glycogen is already present. Glycogen phosphorylase is present. This glycogen phosphorylase want to cut this. Yes, want to cut this. It will require phosphate, but you have sequestered all the phosphate in the form of galactose 1 phosphate. So this glycogen phosphorylase will not get phosphate. So this glycogen will not be broken down. So fasting hypoglycemia, fasting hypoglycemia, hepatomegaly. Fasting, hypoglycemia, hepatomegaly. Did you get this, Amal? Yes. Now, this galactose 1 phosphate accumulate in brain, mental retardation. So, mental retardation. This galactose will accumulate because when more and more galactose phosphate is depleted, all the phosphate are depleted, more and more galactose is coming, extra galactose will be converted to galactitol, oil drop cataract. So oil drop cataract may be present in minor type and major type, classical type. So oil drop cataract. In this patient, yes, this patient came to me. Childhood means a neonate came to you. Neonate, you can't determine the mental retardation in a neonate. So I can say that you can't diagnose by this. Oil drop cataract will take time to develop. Yes, many time in clinical question they will not give. In clinical question, they will give fasting, hypoglycemia, hepatomegaly. Immediately, whenever you will find hypoglycemia, hepatomegaly, you will immediately think about glycogen storage disease. So how you will differentiate? In this, galactose is very high. Although galactose is reabsorbed by renal tubules, some amount of galactose will come in urine. Some amount of galactose is very high. This galactose will come in urine. Benedict test positive. One important point. So in galactosemia, Benedict test will be positive. Galactose would be present in urine. Second thing, there would be relation of symptom with breastfeeding. Yes, because breastfeeding, breast milk has lactose. So now listen the question. A 3-week-old neonate who began vomiting 2 days after birth, usually 30 minutes after breastfeeding. He has abdominal distension with enlargement of liver with jaundice. Yes, patient may present with jaundice, enlargement, consulting did urine step 1 for glucose was negative. Second step for reducing sugar was positive. Reducing sugar was positive, means classical galactosemia. Yes, in von Gierke's disease, no urine dipstick test positive. What about other option? Yes, I will discuss. Don't worry. Why not this? Why not this? I will discuss shortly. Answer is B. So for the time being, you remember this. Yes, sorbitol pathway I leave for the time being. Yes, you know. Before going further, you will find that these patients are susceptible or exposed or susceptible to sepsis by E. coli. Yes, these we found that galactosemia, septosemia, sepsis may occur by which organism? E. coli. This is frequently asked question. They give the clinical scenario just like galactosemia and they ask which bacteria will cause septicemia or sepsis. The answer is E. coli. Galactosemia patient are exposed to, yes, septicemia by E. coli. Now, before